Welcome to Radiology Made Easy. Today, I'm examining a series of selected images from a catheter angiogram of the lower limbs. The angiogram highlights the arterial system from the distal aorta to the upper calf. The catheter was inserted via the left common femoral artery, allowing us to get a detailed view of the vessels. In these images, I'm noticing an abnormality in the left popliteal artery. On the flexion image, there's a clear filling defect in the mid-left popliteal artery, accompanied by medial deviation of the vessel. Interestingly, in the subsequent view, the left popliteal artery seems to opacify normally, with minimal deviation. This variation suggests that the defect observed in the flexion image could be positional. I presume that the third image was obtained with the foot held in a neutral position, which accounts for the apparent resolution of the filling defect. To further evaluate this finding, it would be beneficial to review imaging of the runoff vessels to assess for any distal disease. Additionally, correlating these imaging findings with the patient's clinical presentation is crucial. On the basis of these angiographic images, I'm considering the diagnosis of left popliteal artery entrapment syndrome. This is a condition where an abnormal relationship between the popliteal artery and surrounding muscle or fibrous structures leads to arterial compression, particularly during certain leg movements. This case would be a good candidate for discussion at a vascular multidisciplinary team meeting. Further assessment with an MRI scan might be recommended to better visualize the structural cause, especially looking for a slip of muscle or fibrous band that could be causing the entrapment. For those interpreting catheter angiograms, it's important to note some key points. First, describe the study comprehensively, including the access point and the specific vessels being examined. Also, check for any annotations that might provide additional context. Look carefully for any catheters or balloons that could indicate previous interventions, such as stents, embolization coils, or grafts. When comparing images, pay attention to any abnormalities or deviations in the normal filling of vessels. This can help identify complications like pseudoaneurysm, dissection, or embolus. Considering the differential diagnosis is also key. We must think about various pathologies that could present similarly, including aortic pathologies like dissection or aneurysm, hemorrhage from various causes, subclavian steal syndrome, fibromuscular dysplasia, thromboembolic disease, or hypervascular tumors. Popliteal artery entrapment syndrome, although rare, should be suspected in younger patients, especially athletic males, presenting with symptoms like calf claudication. Angiographic findings can sometimes be nonspecific, but symptoms induced by forced plantar or dorsiflexion in the presence of this defect are highly suggestive. Thank you for joining me on Radiology Made Easy. Every image tells a story, and I'm here to help you decipher it. Please leave your comments and suggestions below, and stay tuned for more detailed explorations in our upcoming videos. See you next time.